Hey guys, my group did dry needling. Dry needling is used to reduce pain and improve function related to myofascial trigger points. Myofascial trigger points are palpable, hyper-irritable, localized areas of tenderness within top bands of skeletal muscle, which may be commonly associated with musculoskeletal pain. Dry needling is a technique involving insertion of a fine needle into specific myofascial trigger points without the use of any medication. It can also help with hypoxia by causing an increase in skin and muscle blood flow from the needle insertion itself. Dry needling is thought to help in the reduction of pain derived from myofascial trigger points by providing a localized stretch to the shortened sarcomeres. Purpose of dry needling. The body releases cytokines, which are small proteins released by cells. It also has to do with vasodilation, increased blood vessel formation, increased tissue repair, and overall endorphin release from the brain.
So a little bit of the history of dry needling. It comes back to 1940s with Dr. Janet Travell. She identified trigger points and referral patterns with wet needling. She noticed that the dry needling shared similar results. So along with Dr. David Simon, they located most trigger points in the body. With this image, it shows the 15 major trigger point places, and the most common ones could be the neck pain, the calf pain, low back pain, or even the quads. So with this image, you can see that it's important to know who is certified to administer the dry needling, such as MDs, PTs, chiropractors, osteopaths, acupuncturists, naturopaths that practice in the United States. It is unfortunately not considered an entry-level technique, nor should it be performed by PTAs as an intervention. According to the American Academy of Medical Acupuncture, this procedure should be performed only by practitioners with extensive training and familiarity with routine use of needles in their practice, and who are duly licensed to perform these procedures, such as licensed medical physicians or licensed acupuncturists. So the requirements. It has to be acquired during the traditional education of a physical therapist. 14% must be acquired through postgraduate education or specialized training in dry needling. Skills in handling the needles and palpating the tissues for dry needling require specialized training and are not part of an entry-level PT training. Excellent palpation skills for locating the myofascial trigger points are needed, and appreciating the differences in the tissues penetrated by the needle. It is important to also distinguish among skin, subcutaneous tissue, muscle top bands within the muscle, and the fascia.
So indications for dry needling. Used for the treatment of neuromusculoskeletal pain and dysfunction, including myofascial trigger point pain and dysfunction, decrease soft tissue pain, muscle tension, scar tissue, improve range of motion and flexibility, and treat trauma, arthritis, and back pain. Some contraindications are obesity, bleeding disorder, current use of anticoagulant, presence of local or systemic infection, acute muscle trauma, inability to obtain informed consent, needle phobia, needling in joints, and needling in vicinity of implanted devices. Some adverse effects are bruising, bleeding, pain during and after treatment, soreness or pain after needling, local hemorrhage at the needling site, sympathetic response, which includes sweating, syncope, and pneumothorax. Some controversies about dry needling. It's within PT's scope of practice, solely adopting the techniques and values, practice in only about half of the states. There are no current procedural terminology or CPT codes. Some payers won't reimburse. More research needs to be done, and it is an invasive procedure. Sticking a dry needle anywhere isn't going to help the pain in the long run. In order to strengthen your muscle, you must do more. So some PT interventions can include hot packs, soft tissue mobilization, Therex, neuromuscular reeducation, functional retraining, and patient education on stretches. Some tips for your next appointment. You can schedule medications prior to your appointment, rest after your appointment, research or look around for PTs, dress accordingly, don't stretch aggressively, and be honest with yourself and your therapist, because too much does not always mean it's good for you.
So dry needling and acupuncture may look exactly the same, but there are some differences. The first one being that dry needling is part of modern Western medicine principles, whereas acupuncture is based on traditional Chinese medicine. Dry needling is used to stimulate trigger points, whereas acupuncture opens up a person's energy flow, known as qi, for healing.
Now we're going to go over the procedure for dry needling. So a pincer grip or flat palpation is used depending on the muscle orientation, location, and direction of the needle penetration. The filiform needle is loosened from the tube. The top of the needle is then tapped or flicked, allowing the needle to penetrate the skin until trigger point resistance is felt. Once the needle is withdrawn completely from the skin, pressure can be applied directly to the skin over the insertion site to prevent swelling or soreness. Muscle is palpated again to reassess for taut bands and trigger points. From there, either more needles are applied or gentle stretches. So here's a quick clip of the procedure being done.
Probably the most serious adverse event possible in the area. To minimize this risk, the needle insertion or any needle manipulation should be done with a pincer grip palpation of the muscle belly. The anterior and more medial trigger points should be needled in a posterior to anterior direction. The more lateral trigger point should be needled in a posterior to anterior and cephalad direction.
So we actually found a case study that compared dry needling to cryotherapy on patients with upper trapezius trigger. So this procedure included 50 subjects that randomly divided into two groups, Group A and Group B. One group received cryotherapy with a stretching technique by side bending to the opposite side shoulder, while the other group received dry needling and the same stretching technique. So these were compared using the visual analog pain intensity scale and were obtained pre and post intervention. Also included cervical lateral flexion by using a goniometer, and tenderness grading scale were used for 20 treatment sessions. So the results were the two groups showed no significant difference in the outcome measures between the characters' age, gender, and duration of illness. Both groups showed improvement from the pre-test to the post-test. Group B did demonstrate quicker improvement. The intervention that incorporated stretching techniques showed significantly better improvement in the pain intensity, range of motion, and grading. So in conclusion, the dry needling therapy is more effective than the cryotherapy in treating trigger point of upper trapezius muscle and reducing pain intensity and increasing range of motion. The dry needling therapy may release the tight muscle bands, which is associated with trigger points and can lead to decreased pain as well as improved function. The cryotherapy effects on the inflammatory response was ineffective and is not supported during recovery.
In conclusion, even though dry needling does not apply to us yet in California, this is still a new concept that needs more research to support it. And we hope that with this presentation, it brings awareness to this topic so that maybe one day in the future, we could use this to provide optimal patient care. And there's a list of our references. And that's all we have.